Good afternoon, ladies and gentlemen, and thanks for joining us on this edition of the program You and Health, aired on Equinoxe Radio Multimedia. For presentation, I am Esia Lucy Liengu. Cardiac arrest is a life-threatening condition that can strike anyone, regardless of age or health status. Thus, the disease requires immediate intervention to prevent the irreversible damage or death. In this edition of the program You and the Health, we will explore the factors that can lead to the disease and equally and how it can be treated. With me here in the studio, we have a cardiologist, but before we introduce our special guest for the day, with me is Immaculate Fogwe, my beautiful co-host for the day. Good afternoon, Immaculate Fogwe.
Good afternoon, Lucy. Good afternoon to all our televiewers and listeners.
Thank you. It's a pleasure having you.
Same here. And good afternoon to our guest, Doctor.
Doctor, of course, our special guest for today is a cardiologist. He is no other person than Dr. Cabral TANTCHOU. Good afternoon to you, Doctor.
Good afternoon, Lucy. Good afternoon, Immaculate.
Always a pleasure having you on the program.
Thank you.
Yeah, well, straight ahead, without any waste of time, we'll go straight to our questions. Doctor, to a layman's understanding, we want to know, what is a cardiac arrest, and is this disease related to heart failure?
Before really talking about cardiac arrest, we should know what is the heart and what is the function of the heart. The heart is an organ in the chest, in the left side of the chest, that is pumping blood in our system. As it's pumping blood, it's pumping oxygen and nutrients in our system. That's why we can move, that's why we can run, that's why we can do whatever we do. Cardiac arrest is when, okay, let me say again that the heart is like an engine of a car. You see, it's the engine that pulls the car, it's the engine that permits the car. If you want to go fast, you go fast. You want to slow, you slow. And without the engine, is sometimes complicated. And if the engine is having a problem, the whole car will have a problem. The car will not be able to do anything anymore, such as the heart. The heart, as it pumps blood in our system, as it pumps oxygen in our body, cardiac arrest is when that engine is not able to pump anymore suddenly, abruptly, unexpectedly. You were doing something or you were moving and suddenly, abruptly, it doesn't pump anymore. And if oxygen is not reaching your system, it's not reaching your brain, your heart, is when you just fall, and that's all.
Of course. So is it related to a heart failure?
Heart failure is a different term. It's a different term. Heart failure is a syndrome, a different syndrome that can link or that can lead to cardiac arrest. But it's not really heart failure. It is cardiac arrest is when the heart stops completely. Yes, due probably to an arrhythmia, a heartbeat that comes and goes fast, and since it's going fast, the heart is not filling itself properly, and oxygen is not reaching our brain. That's really what occurs. Meanwhile, heart failure is a syndrome that is having so many complaints, like patients that are coming that in the night they cannot breathe well, they should sit up. The heart that is beating fast, the legs that are swelling. Cardiac arrest and the heart failure are two different terms, but one can lead
to the other. Now let's look at some of the causes of cardiac arrest. What are some of the causes?
The causes of cardiac arrest, in the past I was invited here and we talked about the heart attack. Heart attack is one of the main cause of cardiac arrest. And heart attack is what? You know that the heart itself also is having some vessels, because heart needs oxygen to pump. And those vessels are giving blood to the heart. And they're really tiny, they're not so big. And due to probably tobacco, due to cholesterol, due to hypertension, those vessels, they get narrowed. And because of those fatty deposits, and sometimes they become also too hard, and blood, it can organize clots can organize themselves due to some factors and bring heart attack when the vessels is completely blocked, meaning that one part of the muscle dies completely. Yes, and when it dies, if the place is big, if the place is huge, is when you have cardiac arrest and the patient can die. If not, there are other problems like congestive heart failure, like arrhythmias. It can be atrial fibrillation when the heart is beating too fast. It can be ventricular tachycardia. It can be ventricular fibrillation. It can be a trauma. There can be also some bradycardia, some problems with the heart rhythm when the heart is too slow and someone wants to do physical activity. There really can have cardiac arrest. That's why it's very, very important. As many people have been hearing about people dying in parkour when they are doing a particular type of exercise, it's due to an arrhythmia, a problem probably that can occur, or a problem that the patient knows ahead of time, but because he's not taking his medications, or because he is not following instructions of the doctors, he goes for those type of exercise and he can die. The patients with hypertension that are not taking their medications, they can develop stroke and later on cardiac arrest. There are so many, really many causes of cardiac arrest.
For those who would like to take part in this program, here are the numbers: 670 54 70 49. I repeat, 670 54 70 49 or 656 622222. 656 622222. Back to you, Dr. Cabral. We'd like to know, who are those prone to suffer from a cardiac arrest?
All people can suffer from cardiac arrest. And there are some particular diseases that can bring, really, that we know that can bring cardiac arrest, like hypertrophic cardiomyopathy. If someone is having hypertrophic cardiomyopathy, is prompt to develop cardiac arrest, because the heart muscle that is too big can develop some arrhythmias that can really bring him to that state. Not only that, I mentioned patients with hypertension, severe hypertension that are not taking that treatment, or probably they think that they are okay. There can be patients with congestive heart failure, also with fast heart rhythm, and sometimes they will not know their condition, and they will take, or they will exercise not knowing that really is contraindicated in their case. There are patients with congestive heart failure again that are not taking their medication, and the body is swollen, and sometimes they don't care at all, and they are really healthy people, okay, in brackets, healthy people that are having some metabolic problems, and not knowing that they are having those problems, and usually it's during exertion that the problem can occur and the patient dies.
Recently, a man died at a supermarket here in the city of Douala while he was trying to buy some things from that supermarket. It is said he suffered from a cardiac arrest. What are some of the warning signs to watch out for as far as cardiac arrest is concerned?
As far as cardiac arrest is concerned, the first warning sign, you can have dizziness, you can have chest pains, you can have headache, you can have as I say, chest pains. You can have difficulties in breathing, shortage of breath. Yes, the heart will be beating fast. These are the main really signs that something is going on wrong, for you to know that something can happen. And in that case, really, you should ask really for help.
Okay. Now, we are talking about cardiac arrest, and we know that it is difficult sometimes to determine that we are suffering from the disease. What are some lifetime changes that we can consider in order to prevent the disease?
This is very, very important to people to know that at a particular age, if you are above 40 or you are 40, above 40, ladies or men, it's very, very important at least to come for an heart evaluation. An electrocardiogram should be done, an echocardiogram should be done. Why? Because there are many people that are moving corpses. They are dead inside, and when they see from above, they think that they are okay. Meanwhile, they are having serious conditions, and they need particular personalized treatment. These are people really I at risk of...
Yeah. 1 minute, doctor. We have a caller on the line. Hello. Hello.
Hello.
Good afternoon.
Oui, bonjour, afternoon.
Good afternoon.
Je voulais parler au médecin, docteur Tantchou.
Pardon, votre nom est là où vous appelez.
J'appelle à Bonaveri. Je m'appelle Maman Angèle.
Oui, votre question, madame.
Oui, je voulais demander au docteur, je voulais savoir son programme de consultation à Païdopio, facile un peu là. Les jours de consultation.
Okay.
Okay. Okay, doctor, you got the question.
Ok, madame, je suis à Padre Pio lundi, mardi, jeudi, vendredi, de 8h à 14h.
And now, thank you for that. How is regular screening important for us to treat a cardiac arrest or for us to prevent a cardiac arrest?
We were talking about people at risk of cardiac arrest, and we mentioned if you are above 40, you should come for an evaluation. That one is really compulsory. It's compulsory, people. Come for evaluation. Come, we check your heart. There are many people with hypertension. You are not taking your medications. Please, if you are hypertensive case, you have been diagnosed with hypertension and you are not taking your medication, or you think that, or you have been taking medications and you feel that you are okay and you don't need them, it's not correct. You should continue with your medication. There's another group of people with congestive heart failure too. Congestive heart failure. They know already their diagnosis and are in a particular treatment. Please take your medication and come for your review, because as you are taking medication, you should come. The doctor gives you appointments. The doctor gives you some particular dates when you should come again for review. Come and really follow up instructions of the doctor. There are people with palpitation. What is palpitation? Palpitation, you feel the heart beating.
We have another caller on the line. Hello.
Good afternoon, madam.
Good afternoon, sir. Where are you calling from in your name?
This is Nyam Christopher from Bole Bakundu under Mbonge.
Thank you. Your question, sir.
Yes, I want to find out from the doctor what are the signs that one can really dictate that is suffering from a heart cardiac arrest. What are the signs that somebody like somebody who is not a doctor can really dictate that somebody is suffering from cardiac arrest? And what is the difference between cardiac arrest and heart attack?
Okay.
Thank you.
I think we have answered this question.
We have answered the question already, but for clarification, just briefly explain to him, doctor.
Cardiac arrest, gentlemen, is when your heart suddenly and abruptly just stops beating, and oxygen is not reaching your brain, and you fall, and probably you can die. And heart attack is when the arteries of the heart are blocked, and really it affects really the heart, and the heart also is unable to pump blood anymore. There you have heart attack, and these are really conditions that those conditions are emergencies, and they need really a treatment so fast, very, very fast.
Is another caller on the line. Hello.
Yes, madam.
Good afternoon. Your name and where you're calling from?
Doris, I'm coming from Boya.
Thank you. Your question.
Yeah, you are taking the doctor's confirmation from the age of 40 going to do your test to know if you are having the problem. But I have a friend who just had an attack and died at a who was 40.
We didn't. Please,
we can't get you clearly, madam.
Can you be audible?
I had a friend who had that attack in the US and just died at the spot.
Yes.
We up to 40. Hearing from doctor that you should go and carry out your test at the age of 40, then I'm surprised.
No, he said everybody is at risk of having a heart attack, but it's very important as from 40 years old, you should go get yourself screened. Is that what you said?
Yes, that's true. That's true. Madam, it's very important to understand that before 40, there are many people that are having cardiac problems. Before 40, it's just a figure, because there are many people that will say, why 40? Why not late?
Why not?
Yes, not later when it's 50. No, 40 is like before that time. There are many people. You should come for your medications. You should come to get your condition screened. And again, if you are not 40 or you're having palpitation, Please come and check. And what is palpitation? That's where I was. Palpitation is when the heart is beating and you feel. When somebody can knock something or the door, or when something falls, your heart makes some kinds, and you can be thinking that it's only anxiety. No. Please, if you are having palpitation, or when you are sleeping, you are moving fast, you feel your heart somehow, come and let the heart be checked. Come and let the heart be checked. These are sometimes conditions, warning conditions, like that man asked too, that what are warning conditions? Palpitation is one of the warning conditions. Sometimes you should be neglecting because you are not feeling pains. You just put it tomorrow, till you have really cardiac arrest. And it's when people will say, oh, probably it's your uncle somewhere or who else. Meanwhile, you had a cardiac problem.
Doctor, we may need another question. Another caller on the line. Hello. Hello.
Hello.
Good afternoon, sir. Your name and where you're calling from?
Jonina Eric. I'm Jonina Eric calling from Bamenda.
Your question, sir.
Yes, I want to first of all thank people for this. It's not really a question, but just a suggestion that some of us, we are just fortunate to be in the house now. If not, we would not have been following the program. If they can be, we don't know when the broadcast will take place, so that we really follow up, especially like in the evening.
Okay, sir.
Thank you. Sir. Thank you.
For those who are not following the program, I think
you can watch on Facebook,
watch it on YouTube, equally on Facebook, on our page.
Equinoxe TV, that's Facebook. You can get all of this information there.
Okay. Now back to you, doctor. We want to understand what is the cardiopulmonary resuscitation. How can it help cardiac arrest, like help to solve the problem of cardiac arrest? What is this? We have the CRP. What is it all about?
Cardiopulmonary resuscitation is a procedure that helps someone that is having cardiac arrest or someone that collapses to recover his life. Why? Because cardiopulmonary resuscitation is a technique that all people should master. Yes.
Can you enlighten us on that technique? Because given the case that we noticed at that supermarket where that Cameroonian pilot who works for Cameco died, we noticed that a lot of people had limited knowledge on this particular affair. If I am walking on the road and I see someone suffering from a cardiac arrest, what should be my first reaction? I think we have a caller on the line.
Good afternoon.
Yeah, good afternoon.
Yes, sir. Where are you calling us from and your name?
Yeah, I'm Abdullah. I'm calling from Douala village.
Your question, thank you.
I don't know. I'm having sometimes palpitation. My heart is beating. At times it makes as if you want to have a break. And later it becomes beating again. And at times I feel like as if I'm having, my eyes are turning.
Okay.
And secondly, I've done echo care, echo cardiac. I've done echography cardiac, but the result comes out normal. No. And they are trying to tell me that I'm having gastric. So I don't really know what is going on. I really want, if possible, doctor should tell me what is it. I can meet him in person then. I don't know.
Definitely, gentlemen, definitely. If you're having palpitation and you are dizzy sometimes and really looks like it's really symptomatic, you should come. You should come. I'm at Padre Pio, and come and we talk, come and we look into the problem carefully.
Okay. And now
we're talking about the case of that pilot who just died. A lot of people were just looking, they were surprised, they were confused, they didn't know what to do. If I'm on the way and I see someone suffering from a cardiac arrest, how should I react?
Yes, Immaculate, it was really very sad, too sad for us cardiologists when you watch the video. And each single person should know the technique of CRP because it helps. And it helps the patient recover, and it's not so complicated. What you should do when the patient is, when you see someone in that kind of condition, you should put the patient on a hard surface.
Okay.
Of course, that far from people, on a hard surface, and you should tilt the head of the patient a bit behind to open the airways.
A bit behind how?
Behind the head.
Okay, the head.
Yes, the
like,
head. You tilt
okay,
it behind
okay.
for the person, for air to pass.
Okay.
And if there's an obstacle, because sometimes it can be vomiting or you can have dentures, or you should clean it up. Clean up. You should clean up and make sure that really air passes well. The next step is to do massage. Is to do massage.
Where precisely?
Where precisely? On the chest. We used to say at the level of the heart, because if now we go into details, it will be a bit complicated for people to understand well.
Okay.
Each person knows approximately where the heart is.
What type of massage?
Yes, what type of massage? You
Yes.
put both arms.
Okay.
Yes, the first palm of the hand at the level of
the chest,
the heart, and the other palm on the other hand, and you press deep.
Really deep?
Very deep. You feel your whole body, not that as you are joking or you are just touching. No, with your whole body, you press deeply. Yes, and you should make sure really that the ribs are going down. It's something like 2 centimeters.
Wow.
It should be really compressing the chest well. Yes, you compress. You should do like that 30 compressions and you should breathe in the mouth of the patient. Yes, mouth to mouth. Yes, it's to save lives.
Okay, I would understand. Yes. I understood anything.
It's to save life, and if there can be a tissue that you can put for hygienic, I don't know, protection, something like that. Yes. But you should.
But at that moment, you want to save life.
Actually,
that's the most important.
That's it. You breathe 2 times and you continue. When there are 2 people, that one is better. Yes.
Okay.
When you are alone, 30 compressions, deep compressions with your whole body. It should go down well.
Okay. Thank you very much, Doctor. Any last advice for a patient?
If you are sick, if you are having palpitation, if you are hypertension, if you are having all kinds of cardiac problems, don't neglect your condition. Take your medications and come for the reviews that are appointed by the doctor.
Immaculate. Thank you.
He has said it all. Make sure you go to the hospital in case you have any issue.
Okay, ladies and gentlemen, thank you so much. We have come to the end of this program, You and Health, aired on Equinoxe Radio Multimedia. Our guest today was Dr. Cabral TANTCHOU. He is a cardiologist, while I was assisted, or my co-host, of course, was Immaculate Fogwe. On the technical dashboard, we had Bertrand Bonzini and Jonathan Babiola. Myself, I am Esie Lucy Liengu. Sure, we live in the company of interesting programs on Equinoxe Radio and television.